Depression, a dark, lonely, and seemingly bottomless pit filled with feelings of shame, doubt, sadness, and terrible guilt. Amanda Seyfried once explained, "You don't see the mental illness. It's not a mass, it's not a cyst, but it's there. Many people may find themselves in this position, yet many don't obtain the treatment they need to have an acceptable quality of life." Life doesn't have to end with depression. There are ways to climb out of this pit. Individuals just need the appropriate tools to help them along the way. The purpose of this presentation is to portray a real-life scenario regarding a patient with major depressive disorder and the treatment and therapy that corresponds. The nursing diagnosis that relates to our selected patient, a middle-aged mother named Jessica, is powerlessness related to insufficient interpersonal interactions as evidenced by alienation, shame, depression, and doubt about inability to perform previous activities. Throughout the reenactment of Jessica's situation, 3 main interventions will be implemented. First, situations will be identified that led up to Jessica's state of powerlessness. Next, strength, assets, and past coping strategies will be identified that were successful for her. Finally, Jessica will be encouraged to think productively and positively and take responsibility for choosing her own thoughts. Safety is of utmost importance when dealing with any patient, especially patients who are severely depressed. Suicide is an unfortunate last resort for many. Therefore, the patient must always be evaluated for potential risk of self or other directed harm. While seemingly abrupt, asking the patient questions such as, "Have you ever thought about taking your own life?" and "Do you have a plan to harm yourself or others?" can bring the issue out in the forefront so it can be managed appropriately. If the patient appears to have a significant risk for suicide, one-on-one supervision with a certified sitter can be paramount in saving a life.
This is a dramatization of actual events. The names have been changed for HIPAA.
A middle-aged mother named Jessica has had a long-standing history of untreated major depression. Over the course of 6 months, several stressors in her life have resulted in strong feelings of powerlessness and low self-esteem. Jessica sits with her daughter, Kate, and talks with her about all of her major life changes. Jessica has just left her husband of 20 years and is now living alone. The split with her husband resulted in a complicated divorce that has left her frustrated and lonely. On top of these negative circumstances, Jessica has also taken on a new career that has further piled on the stress. All of the stress Jessica has experienced over the past 6 months has ultimately led to a psychotic episode. Severe stress and anxiety are both known to trigger these types of episodes in vulnerable people. Jessica has a complete breakdown and experiences severe insomnia, profound diaphoresis, racing thoughts, delusions, and excessive fear. Hysterical, she calls her daughter in the middle of the night.
Why is she calling at 2 o'clock again? Hello?
Hey, Kate.
Yeah.
Why am I awake?
Mom, I don't know. It's 2 o'clock in the morning. Why are you calling me right now?
I know, but something's really wrong. I don't know. I just don't feel right. I don't think my medications are working. I think they're placebos. I just don't even know right now what to do. Can you come over?
Mom, that doesn't even make sense. Of course I'm not going to give you placebos.
Can you come over?
Well, if you think something's really wrong, you should go to the ER and let me know if you're going, because I'll meet you there.
Okay. I'm sorry. Bye.
All right. I have to go meet my mom at the hospital. I don't know what's going on.
Jessica drives herself to the nearest emergency room, knowing something is terribly wrong. Upon admission, she's Baker-acted. Over the course of 4 days, Jessica meets with the ER doctor, Shi-Ann, and a psychiatric nurse, Nikki. She participates in group therapy after having a full psychiatric evaluation to determine her current state of mind and level of functioning. Jessica is evaluated for risk of suicide and receives medications to help her calm down.
Hi, I'm Nicole, and I'll be your nurse today.
Hi.
Hello. Okay. So, what is your name and your date of birth?
Jessica Cox, 2162.
Oh, that's a very pretty name.
Thank you.
Do you have any allergies?
Penicillin.
Okay. Do you drink or smoke?
I smoke.
Okay. How many packs per day do you know?
About 2.
2 packs per day? Okay. And are you taking any medications?
Diabetes medication and some for depression.
Okay. So can you tell me what brought you in today?
Well, I was up all night crying and I cannot stop sweating and I just feel like I can't catch my breath and just something's wrong.
Okay, you must be going through a hard time. Can you tell me a little bit more about that?
Well, 6 months ago I left my husband and I'm going through a divorce and I'm living alone for the first time and I started a new job and just everything's changing. Everything's going on.
Okay. Well, now I'm going to check your vitals just to rule out any medical conditions. Okay, first I'm going to listen to your heart.
Okay.
Okay. I'm going to take your blood pressure. Okay, your blood pressure is 130 over 80. I'm going to check your temperature. Okay, 98.6. And your respirations are 24 and your heart rate is 110. Okay, so now I'm going to ask you a series of questions just to evaluate your mood and if you have any risks.
Okay.
Okay. You can stop me at any time if you have any concerns.
Okay.
Over the last 2 weeks, have you lost interest in doing things?
Yes.
Have you been feeling down, depressed, or hopeless?
Yes.
Have you had any trouble falling asleep?
Yes.
Are you currently taking anything to help you with that? Maybe melatonin,
Zoloft.
Zoloft?
Mm-hmm.
Okay. Have you had any changes with your eating habits?
Yes.
Are you eating too much or just a loss of
Yes.
appetite?
I'm not hungry. I don't want to eat.
Okay. Have you thought that you'd be better off dead? Or have hurt yourself?
Sometimes, and then dealing with all of this, yes.
Do you have a plan?
No.
So how have you been coping with this?
Not very well. I used to go to church. I don't want to go anymore. I don't trust anyone. I don't know who's really there to help me and who's not.
Do you find it difficult to cope with this?
Yes.
Well, I'm going to go consult with your doctor and she'll be with you shortly.
Okay.
Okay. If you need me, just pull your call light.
Okay.
Thank you.
Thank you.
Okay, I'm going to be your ER doctor today. Can you tell me your name?
Jessica Cox.
Okay, I'm Shi-Ann. Can you tell me a little bit about what's been going on with you?
I'm a mess. I'm just overwhelmed and I can't, my mind is racing and I'm sweating and I'm just, I don't know.
Okay.
I really don't know.
I'm going to take some vitals really quick.
Okay.
gonna take a listen to your heart and your breath sounds, okay?
Okay.
Okay, your respirations and your heart rate are a little bit high.
Yeah.
I have a few questions for you, okay?
Okay.
Have you ever thought about harming yourself or anyone else?
Yes.
You have?
Yes.
Have you ever thought about what you would do if you were to harm yourself or anyone else?
Not really, no.
Okay. Has that been current or in the past or both?
Both, yeah.
Okay, I'm gonna prescribe you some Ativan to help you relax your nerves for right now, and I'll tell your nurse Nikki to go get that for you.
Okay.
Based on your observations, I think we're gonna go ahead and Baker Act you just for your own safety. Do you know what that consists of?
No.
No? Okay, so we're just gonna keep you on hold for observation for 72 hours, and then we'll reassess after those 72 hours, okay?
Okay.
Okay, I'll go talk to your nurse and get her to give you that medicine, okay? Okay.
Upon discharge from the inpatient facility, Jessica continues on in outpatient treatment. She is referred to Dr. Carr, a psychiatrist, who evaluates her current situation and prescribes the right medications she needs in order to manage her depression. Dr. Carr refers Jessica to a therapist who will implement cognitive behavioral therapy to help Jessica change her faulty thinking and negative thought processes. Trigger avoidance and positive coping strategies are two major points discussed with Jessica to further help her manage.
Hello.
Hi.
Hey, I'm Desiree.
I'm Jessica.
I'm the nurse practitioner. How are you?
I'm okay, I guess.
Okay. And who are you?
I'm her daughter, Kate.
Hi, Kate. All right, Jessica. So my role here is to just guide people through mental wellness, okay? And I just wanted to let you know that everything is safe beyond these doors. I don't say anything, so it's a safe zone. So whatever we talk about, no one else knows, and whatever we bring up, again, no one else knows, okay? So with that being said, I just want to know, have you ever thought about hurting yourself?
I guess, yeah.
Okay. And how would you do so?
Well, I haven't really thought that far into it. It was just more of, I can understand why people would kill themselves the way I feel. Like how I feel, I can understand why someone would. I haven't really thought about doing it to myself, but thought about it, I could understand.
Okay, I understand. All right, so before we get started, I just want to do just a couple tests, okay? My first one is called a mini mental exam, and I'll actually help you fill that out.
Okay.
Here it is right here. So do you know the year, season, date?
2018 summer, I think it's July 9th.
Okay. And where are we now? Can you tell me the state, the county?
We're in Clay County, Florida.
Okay. So if you can you just spell world backwards?
DLROW.
Okay. All right. So go ahead and repeat the phrase, no ifs, ands, and buts.
No ifs, ands, or buts.
Okay. All right. So we did okay on that, and that was just to clear up any other things going on with cognition and things of such, okay?
Okay.
Okay, the next thing I'm going to do is called a neuro test, so I am going to get hands-on and stuff like that, okay? So you know your name, just tell me your name and date of birth.
Jessica Cox, 2162.
And you know where you are today, right?
Mhm.
Yeah. Okay. So what I'm going to do is I want you to follow my pen, okay? So look straight this way and just follow my pen with your eyes, okay? Ready? Okay, great. Now there's going to be a light. Look straight ahead. Okay, awesome. Are you able to stick out your tongue? Okay, you wiggle it around, puff up your cheeks, and turn to the side and cough for me. Okay. All right. All right, so I'm going to do soft and sharp. You tell me if it feels soft or sharp, okay? I need you to close your eyes, and this is just testing your sensory.
Soft. That's soft.
Okay.
Hard? Sharp? Sharp?
Okay. All right. You able to put your hands up, down, kick out, back? Okay. Now I'm going to do it with resistance. Can you kick again?
Mm-hmm.
Okay. Go like this. Push against me. Okay, great. All right. So now what I want you to do is just squeeze my hands.
Like across or just
No,
normal?
just, yep, as hard as you can. Okay, great. So that was just testing your cranial nerve, just seeing if everything is intact, and you
Okay.
did good on that, okay?
Okay.
So now we're just going to go over some questions I have to ask you, all right?
Okay.
Now, I'm sure you've been asked these before, so. Okay. Do you have any use of drugs or alcohol? No? Okay. Any co-occurring medical condition?
I have diabetes. I've been diagnosed with PTSD and major depressive disorder.
Okay.
Yeah.
So that's your co-occurring psychiatric disorder, PTSD?
Oh, yeah.
Okay. Have you ever gone through or felt just anything like this before?
Yes, about 6 years ago I had a nervous breakdown, and it was similar to this.
Okay. Can you tell me about it?
The same kind of thing. I just didn't feel safe at work. I didn't feel safe at home. I didn't know who I could trust. I was even doubting my children, my husband. I just didn't know what to do, and I ended up in the hospital then too.
Okay. So you realized that the hospital was maybe a safe zone for you.
I knew I needed help.
No, you needed help. And so,
Yeah.
what do you think was it? What's going on now? Is there something different about it, or does it kind of feel like the same situation?
It feels the same, but I think it's more of my divorce. I'm just all upset over it.
Okay. Is there anything else new going on in your life?
I'm living alone, first time ever. I started a new job, and since my last nervous breakdown, I had been out of work for almost 6 years. So it's a lot going on, a lot of things at the same time.
I understand. So who do you live with? You said you live alone?
By myself, me and my
Okay.
dog.
So who do you trust this current moment? Who do you trust?
Barely anyone. I mean, sitting here talking to you is even hard. Even my daughter, I'm not sure day to day if she's really for me, if she really cares. I don't know.
Is she okay being in the room right now?
Yes.
So who do you talk to when you're upset?
My friends. I do call my friends. I do call my daughter. I know she doesn't like it, but I do call her.
I don't mind. It's just when I get woken up at 2 o'clock in the morning, just because
Yeah.
you don't know why you're awake is a little frustrating. But
Yeah, I'm having a really hard time sleeping, and I don't understand because my medications have been helping me all these years to sleep and stay asleep. Now they're not working, so I don't even know if they're real. I don't believe that they're working anymore.
Did you stop taking your medication?
No.
Okay. So culturally, spiritually, do you go to church?
I did, and I can't even get myself to go now. My mind gets going, and I just can't.
Okay. So spiritually talking, since you do go to church, how do you view your depression? If you're able to answer that.
It's evil.
Evil.
Yeah.
Okay. Have you ever tried taking any herbs over the counter or anything over the counter?
I took St. John's wort years ago, but nothing lately.
Nothing lately.
No.
Okay. So moving on, Jessica, I'm actually going to prescribe you some things. And I know you've taken these medications in the past, but I think I might up your dose a little bit and see how that does you.
Okay.
Have you ever heard of Seroquel, Zoloft, or Xanax?
Yes.
Okay, you
That's-
familiar with those?
Mhm.
Yeah?
Yeah.
Okay, so Seroquel, we're doing 200 milligrams by mouth every day.
Okay.
Zoloft, 150 milligrams by mouth every day. And Xanax is only 1 milligram by mouth as needed.
Okay.
Okay? The thing I want to mention with Seroquel and Zoloft, and even Xanax, they do make you tired and sleepy.
Right.
No alcohol, no driving machinery. I would recommend taking them at night.
Okay. That's what I've been doing, and they worked for a while, but we'll try.
Okay. All right. So, just legal-wise, I have to tell you exactly what these medications are for.
I
So, Seroquel, they treat mental mood conditions like depression, which I believe that's something that you're going through right now.
Yeah.
It's known as an antipsychotic drug, but don't let that turn you away, okay? It does restore the balance of certain natural substances like neurotransmitters in your brain. And that's basically what depression is. It's just an imbalance of chemicals within the brain. It can decrease hallucinations and improve your concentration, which I think would benefit you.
Okay.
Helps you think more clearly and positively about yourself, improves mood, sleep, appetite, energy level, and things of such. So with this Seroquel, we're gonna start. We can up the dose, but we're gonna start it at this dose, and we're gonna gradually up it if we need to. Okay. Just side effects: constipation, drowsiness, upset stomach, tiredness. Like I said, avoid alcohol or marijuana, anything like that with that. Okay. And then Zoloft, same thing. It treats depression, anxiety. It improves mood, sleep, appetite, unwanted thoughts, and even panic attacks. It is the SSRI. You may be familiar with this, but if you take any over-the-counter with the SSRI, make sure you read, if it's compatible or not, or call your pharmacist. Okay? So Zoloft restores the balance of serotonin in the brain. That's basically how it works. Again, nausea, dizziness, drowsiness, dry mouth is side effects. So with this Zoloft, no NSAIDs, no ibuprofen, and warfarin. Are you on warfarin?
No, I
No
do
go
take
there?
ibuprofen a lot.
No
I
more
have
ibuprofen.
Arthritis. Okay.
No more ibuprofen, okay?
Okay.
And then Xanax as well. Are you familiar with Xanax?
Yeah, I've had that. I've been having that on occasion too.
Okay, so
Lately, especially for just to go to work, because otherwise I'm dripping sweat. So I take a half of one before I go to work.
okay.
And it's helped.
Okay.
Mhm.
So this also treats anxiety and panic disorders. Drowsiness, dizziness, increased saliva production, change in sex drive, things of such. Okay, that's only as needed. So if you really feel like you need something to calm you down or just make you relax, Xanax, you would take your Xanax. Okay.
Okay.
All right. So last but not least, I'm going to refer you to therapy.
Okay.
Have you been to any sorts of therapy in the past? or-
I've done group therapy for years, but same thing when this started. I just can't. I don't trust anybody anymore.
Okay. So these are going to be group therapy sessions.
Okay.
You will practice cognitive behavior therapy. This would help with like positive self-talk, dealing with stressors, and also trigger avoidance. Okay, and I really think that would help you in your time of, I guess, a new life, living alone, and your divorce, and things like that. Okay. All right. So just to wrap up things we've talked about, Jessica, make sure you take your meds as prescribed, okay? You never miss a dose.
They won't make me a zombie, will they? 'Cause I don't want to be a zombie.
No,
Okay.
they won't.
Okay.
Especially since we're starting out this dose and we're going to gradually work our way up if needed, okay?
Okay.
And you're going to take them at night as well, so it'll help you sleep and things like that. So even when you're feeling better, I don't want you to stop taking it, okay?
Okay.
All right. I'm also going to give you information about everything we talked about today, the therapy, the meds, okay? Just other educational materials about depression, okay? All right. So try to attend all your therapy sessions and just follow up with me in 4 to 6 weeks, okay?
Okay.
Is there anything else you want to mention?
No, I just want to get better.
Well, your progress has definitely began here, okay? So here's my card. Make sure you follow up.
Okay.
All right, nice
Thank
meeting
you.
you.
You too.
Nice meeting you.
Jessica knows that recovery will be a lifelong effort. She sits with her daughter to discuss several recovery interventions, and Kate works with her mother to come up with a plan for managing her depression. This isn't the end of the road for Jessica. She's fighting back. Jessica's breakdown is an example of a significant incident that can occur in individuals battling major depressive disorder. It's important to know that one doesn't have to fight alone, and that treatment is available. While there is no cure for this unfortunate disorder, there are effective medications, therapy strategies, and several procedures available that help to lessen the burden on those affected. Jessica continues on her lifelong road of recovery, accepting help from others, support from loved ones, and with the knowledge that she is worthy of a meaningful life.